common somewhere or be a term?
These are common.
Yeah.
So yes, the first generation of antidepressants called tricyclics and MAO inhibitors. So they affect multiple neurotransmitter pathways in the brain, and norepinephrine, serotonin have a lot of side effects. We'll get to the one that doesn't necessarily. So tricyclics, weight gain, dizziness, dry mouth and eyes, sedation. MAO inhibitors interact with a chemical found in many foods, including cheese, smoked meats, and red wine. So eating these foods while taking an MAO inhibitor can result in dangerously high blood pressure, leading to stroke or even death. Second generation antidepressants include trazodone and bupropion. So generally no more effective than the first generation one, and they turn out to have many of the same side effects. So we end up with this. So SSRIs, right? Selective serotonin reuptake inhibitors. So class of antidepressant medication increases the availability of serotonin in the brain and cause fewer side effects than earlier antidepressants. Prozac, Paxil, and Zoloft, all examples of what people are prescribed these days. Or the generic version of these as well. So the new antidepressants act much more selectively in targeting specific serotonin pathways, meaning mood stabilizing. So Prozac and other SSRI antidepressants tend to produce fewer, milder side effects. Headaches, nervousness, difficulty sleeping, loss of appetite, sexual dysfunction, all possible. But again, a little better than tricyclics and MAO inhibitors. So then we have dual action antidepressants. They affect serotonin levels, but their mechanism is a little bit different than SSRIs. They have different side effects. Then we have dual reuptake inhibitors, so affecting levels of both serotonin and norepinephrine. They seem to be somewhat more effective than SSRIs in alleviating the symptoms of depression. Diminished sexual interest and weight gain are side effects that go along with dual reuptake inhibitors. Then we get to something kind of odd, because a lot of people don't think that it exists anymore, shock therapy, but it does. Electroconvulsive therapy, ECT, biomedical therapy used primarily in the treatment of depression that involves electrically inducing a brief brain seizure. Sounds dangerous. If you have ever seen the movie A Beautiful Mind, it's got Russell Crowe in it. It chronicles the life of John Nash, a brilliant mathematician who suffered from schizophrenia. And it kind of, like his schizophrenic episodes almost allowed him to think a little bit differently about math. So he ended up getting off of medication and kind of just embraced it and understood that the voices weren't real. Again, brilliant. Came up with game theory, stuff like that. I don't know if you read anything into that. But in that movie and in John Nash's real life, he had electroshock therapy, and it would help him for months at a time to not have these episodes. But he would continue to get the treatment until eventually, he kind of just learned to live with his disorder. So most commonly used to treat depression, it is occasionally used to treat mania, schizophrenia, and other mental disorders. So the procedure is this. Electrodes are placed on one or both of the patient's temples. The patient is given a short-term light anesthetic and muscle-relaxing drugs. While the patient is unconscious, a split-second burst of electricity induces a seizure, lasting for a minute. To treat major depression, the patient typically receives 2 to 3 treatments per week for 2 to 7 weeks, with less frequent follow-up treatments for several additional months. In the short term, ECT is very effective treatment for severe depression. About 80% of depressed patients improve. Because of its rapid therapeutic effects, ECT can be a life-saving procedure for extremely suicidal or severely depressed patients. So if you're extremely suicidal, you can't get out of it, medication's not really helping you, this might be the way that they go. Okay? They're going to knock you out, they're going to shock your brain for a minute, 2 to 3 times a week, for 7 straight weeks, with follow-up shocking treatments for the months to come. Doesn't sound very good, but again, you know, extreme depression, suicidal thoughts. So risks: amnesia and disturbances in language and verbal abilities. These antidepressive effects can be short-lived. Again, this is just a short-term solution to an extreme problem. Then we have experimental treatments. So we have transcranial magnetic stimulation, TMS. So this involves stimulation of certain regions of the brain with magnetic pulses of various frequencies. Unlike ECT, it requires no anesthetic, induces no seizures, and can be conducted in a private doctor's office rather than a hospital. Then we have vagus nerve stimulation, so VNS, involved in the surgical implantation of a device about the size of a pacemaker into the left chest wall. So right here, the device provides brief intermittent electrical stimulation to the left vagus nerve, which runs through the neck, connects to the brainstem, and kind of, again, turning your brain on in certain areas. Then we have deep brain stimulation, DBS. It utilizes electrodes surgically implanted in the brain and a battery-powered neurostimulator surgically implanted in the chest. Wires under the skin connect to the 2 implants, and the neurostimulator sends electrical signals to the brain. TMS, VNS, DBS, still experimental. Maybe not these days. It might be a little bit more common now. But like ECT, electroconvulsive therapy, the specific mechanism by which they may work is not entirely clear. We definitely just know that we're working with, you know, electrochemical situations in the brain. Still, researchers are hopeful that these techniques will provide another viable treatment for people suffering from severe psychological symptoms. Some weird things about this is, I don't know if you've ever watched this happen before, but they can implant something in your brain, take a device, they can move it over it, again like a magnet, and they can use these 2 magnets to turn specific areas of your brain on. And you know, I read about an instance where a person had autism, so like a high-functioning person with autism, and they turned on certain parts of her brain that experienced empathy more than she's ever felt before in this study. And so what happens is she had a problem being empathetic with people and understanding other people's emotions. And in this procedure, they turned it on. And she felt it, and she felt empathy. And then after the procedure, she took it off. They took it off, and it was all done. And she said she was disturbed by it because she now knew what it felt like, what she was missing in her brain, and you know, her brain's abilities, and it kind of left her feeling more empty than actually helping her understand that, you know, empathy in its entirety. If you can understand that at all, you know, it's like you know, you get something and then somebody takes it away and you never get it again, only for you know, a second or whatever. So you only have this instance of what it feels like to have it, and then you know that maybe life could be better with it, and so you feel this emptiness afterwards, because, you know, I guess you feel your I don't know. I'm looking for a word and I can't find it. All right, everything in one place: benzodiazepines, non-benzodiazepines, antipsychotic medications, and we are done with chapter 15. Hold on a second, I'm going to show you a video of the tardive dyskinesia, and we're done.